Hello everyone, we are from Group 4 and we will present to you about the clinical use of the enzyme aminotransferases in patients with liver disease. What is aminotransferase? Transaminases or aminotransferases are enzymes that catalyze the transfer of an amino group from a donor molecule to a recipient molecule. The donor molecule is usually an amino acid and the recipient molecule is usually an alpha-2 keto acid. Aspartate aminotransferase AST, formerly termed glutamate oxaloacetate transaminase GOT, and alanine aminotransferase ALT, formerly termed glutamate pyruvate transaminase GPT, are the two aminotransferases of greatest clinical significance. These two enzymes are normally found primarily in cells in the liver and heart. The magnitude and evolution of AST and ALT can provide useful clues to the nature of the underlying liver disease. Why we need this enzyme for patients with liver disease? Alanine transaminase ALT. Alanine aminotransferase ALT is an enzyme found mostly in the cells of the liver and kidney. Much smaller amounts of it are also found in the heart and muscles. Normally, ALT levels in the blood are low, but when the liver is damaged, ALT is released into the blood and the level increases. This liver test measures the level of ALT in the blood and is useful for early detection of liver disease. A number of conditions can cause damage to liver cells, resulting in an increase in ALT. The test is most useful in detecting damage due to hepatitis, inflammation of the liver, or as a result of drugs or other substances that are toxic to the liver. Aspartate aminotransferase AST is an enzyme found in cells throughout the body but mostly in the heart and liver and, to a lesser extent, in the kidneys and muscles. In healthy individuals, levels of AST in the blood are low. When liver or muscle cells are injured, they release AST into the blood. This makes AST a useful test for detecting or monitoring liver damage. A number of conditions can cause injury to liver cells and may cause increases in AST. The test is most useful in detecting liver damage due to hepatitis, drugs toxic to the liver, cirrhosis, or alcoholism. AST, however, is not specific for the liver and may be increased in conditions affecting other parts of the body. How is it used? ALT is commonly tested in conjunction with AST as part of a liver panel. Both ALT and AST levels usually rise whenever the liver is being damaged, although ALT is more specific for the liver and, in some cases, may be the only one of the two to be increased. An AST-ALT ratio may be calculated to aid in distinguishing between different causes and severity of liver injury, and to help distinguish liver injury from damage to heart or muscles. ALT and AST levels are often compared to the result of other tests such as alkaline phosphatase ALP, gamma-glutamyl transferase GGT, total protein albumin to globulin ratio AG ratio, and bilirubin to help determine which form of liver disease is present. ALT and AST are often used to monitor the treatment of liver disease to see if the treatment is working and may be ordered either by itself or along with other tests for this purpose. Sometimes AST may be used to monitor people who are taking medications that are potentially toxic to the liver. If AST levels increase, then the person may be switched to another medication.
When is it ordered? AST and ALT may be ordered as part of a comprehensive metabolic panel (CMP) when someone has a routine health examination. An AST and ALT test may be ordered along with several other tests when a person has signs and symptoms of a liver disorder. Some of these may include weakness, fatigue, loss of appetite, nausea, vomiting, abdominal swelling and/or pain, jaundice, dark urine, light-colored stool, itching, pruritus, swelling in the legs and ankles, and tendency to bruise easily. AST and ALT may also be ordered either by itself or with other tests for people who are at an increased risk for liver disease, since many people with mild liver damage will have no signs or symptoms. Some examples include persons who might have been exposed to hepatitis viruses, persons who are heavy drinkers, persons who have a history of liver disease in their family, persons taking drugs that can damage their liver, and persons who are overweight and/or have diabetes. When AST and ALT is used to monitor treatment of persons with liver disease, it may be ordered on a regular basis or during course of treatment or to determine whether the therapy is effective. What does the test result mean? Low levels of AST and ALT in the blood are expected and are normal. Very high levels of AST and ALT, more than 10 times normal, are usually due to acute hepatitis, sometimes due to a viral infection. With acute hepatitis, AST and ALT levels usually stay high for about 1 to 2 months, but can take as long as 3 to 6 months to return to normal. Levels of AST may also be markedly elevated, often over 100 times normal, as a result of exposure to drugs or other substances that are toxic to the liver, as well as in conditions that cause decreased blood flow ischemia to the liver. With chronic hepatitis, AST levels are usually not as high, often less than 4 times normal, and are more likely to be normal than our ALT levels. AST often varies between normal and slightly increased with chronic hepatitis, so the test may be ordered frequently to determine the pattern. Such moderate increases may also be seen in other diseases of the liver, especially when the bile ducts are blocked or with cirrhosis or certain cancers of the liver. AST may also increase after heart attacks and with muscle injury, usually to a much greater degree than ALT. In most most types of liver disease, the ALT level is higher than AST, and the AST to ALT ratio will be low, less than 1. There are a few exceptions. The AST to ALT ratio is usually increased in alcoholic hepatitis, cirrhosis, hepatitis C virus-related chronic liver disease, and in the first day or two of acute hepatitis or injury from bile duct obstruction.